Hello, loose gadgies. It's Tuesday. Wink, wink. Sunday. Recording a bit earlier today because my folks are in Bamborough, in a townhouse. They've treated themselves to this holiday thing through the Eager Partnership. Aye, I've already had the photos and the videos. It's good.
I bet you they've
So
had their Sunday dinner, haven't they? And you've missed out on yours.
probably, well, that my mum will have a regular hunter's chicken and my dad will have his gammon.
Yeah.
He
Is
has
he
gammon just
is
about
he
every day.
egg or pineapple?
Do you know he'll have either, but I'm sure he usually asks for the pineapple, or better yet, a battered pineapple. You know, the ones you got at the chip shop.
Yeah.
Aye, 'cause he's only
Pineapple
ever
ring.
the pineapple ring or the corned beef, the battered corned beef patty. Loves a bit of
Yeah.
that from the chip shop. Aye. So Mark, you've got a biggie this week.
Mm.
NHS. Have you had?
Yeah.
So you've been having experiences with that lately, and
Couple of things that happened this week that just made me sort of reflect. I mean, I know is it the NHS what 75 plus years old now?
we aye.
Yeah.
Yeah, yeah.
And obviously there's a lot going on sort of post COVID, a lot of
Hmm.
backlog, and then obviously we've
Hmm.
got the disputes which is creating further backlog.
Yeah, yeah,
And then a couple of things that have happened
yeah.
that just made me reflect on the original concept of the NHS and how it's changed. The thing I remember as a kid was like things like the dentist. You know, as a kid, I would
Oh,
go to the dentist.
the school dentist was
Yeah,
a
yeah, and
horror show.
you never gave it a
Absolute horror.
second thought. And probably even I can't remember this far back, but opticians was that part of the NHS?
I remember we used to make fun of the kids in school that had the NHS glasses. You know,
That's it. So it
they were
must
like
have been.
they were like Pyrex dishes, weren't they? The
That's it.
eyes were
You either had
massive.
pink as a girl and blue as a boy,
Aye. Oh,
and
aye.
and and
Plastic, thick rims,
And I
you
think there's
name it.
something about maybe your eye test, which is free, depending on what your concept of free is.
Mm.
Um, and obviously that's going one way, and then um, things like the dentist. I hadn't been to the dentist for a while, and I went to my local dentist, and I was like, I'd like to be a patient, and she was like, you've got no chance, NHS, and I was like, no, no, I was like, I'll go private. So the first words out of her mouth were, you've got no chance as an NHS patient. So, you know, those
Yeah.
days where you'd automatically be going on the NHS are basically gone on there. So,
Yeah,
and
it was a much lauded thing at one point. Now it's like I don't make any money taking
and
NHS patients. So it's,
and you hear of maybe these odd local ones that are opening up, and the
mm-hmm.
queues round the corner to
Oh
register.
yeah,
You
yeah. I've
know,
seen some of that on the news. It's horrific. There's one
and
guy sat with his laptop in the street in the
yeah,
queue.
and then what happened? My mother had an operation on her foot, and yeah, it was a personal choice. She decided to go private, but treatment she got, aftercare, blah blah blah. Obviously, waiting for that operation on the NHS was
Hmm.
indefinable,
Hmm.
which affects quality of life. And then, interestingly enough, I had some tests end of January, and then I think it was the 20th of February. So 4 weeks later, after the test, I got a phone call from the surgery, and she says nothing to worry about, but she said the doctor would like to have a chat with you about the results of your tests. And I was like, oh
Hmm.
yeah, no problem. She said, would you prefer to come into surgery, or would you prefer to have a phone call? I said, oh, I'm not really bothered. I said, I'm quite happy to have a phone call. I said, I can describe, I said, when's the next available appointment for having a conversation with the doctor? This is on the 20th of February. And she went, 20th of March. And I went, right, 20th of March? And she went, yes. And I said, oh, okay. I said, to physically see the doctor, when's the next appointment? And she went, the 19th of March. So to talk to him is a day later than actually physically seeing him. So I plummeted for the I plummeted for the 19th. So in terms of getting my results from the test that I had at the end of January, I will get them at the end of March.
Wow, it's a good job your foot's not chopping off or something. Or
Good job, I've not got bits falling off.
gangrene or something. Aye.
Yeah, and then I sort of thought of other things like Robin, even though she's in her early 20s, she keeps getting tonsillitis quite a bit. Now I remember when me and her are about the same age. When I was 23, I had my tonsils out. I went to the doctors. I had some issues with my tonsils. I said I want to take them out. Anyway, that within a couple of months I was in, I had them taken out. Robin was told, unless you're getting tonsillitis 7 times a year, we're not doing the operation. 7 times a year you have to have tonsillitis to warrant going on the list.
Wow.
Yeah.
And my brother had all that done because he had the similar issue, just kept getting repeated. I don't know how many times it was, but he ended up having those out and his adenoids. So right in the back of his nose, the back of his throat, he just had the lot out because they were like, look, while we're in, we'll do the lot. You don't have to come back, and you won't have any more bother. That's what it was about. It was about solving the problem.
Yeah.
Wow, 7 times.
Well, the other thing that's happened recently is, which you'll hear advertisements on radio and whatnot, is the positive encouragement to go to your chemist now for advice.
Yeah.
Particularly boots. So you're now being asked to go to your chemist if you've got certain ailments and to discuss it with your chemist. Now, Boots are advertising that, but at the end of the advert, Boots are also saying that some of these facilities may be chargeable. So we're now moving people out of the doctor's surgery into the chemists. Yeah.
Right.
So I'm talking about a slow, subtle movement away from what I would call the NHS, core. Now, and it's not just Boots. You could go to any chemist. Now, the interesting thing about it was when I lived in Thailand, we could go to Boots the chemist and we could get antibiotics over the counter, no problem, no questions asked.
Yeah, I think that's a problem when people use them for spots, like one of my exes did.
Yeah.
Well, then you're going to help all these different infections build up an immunity to them, which then means that antibiotic becomes ineffective. So I always believe that they should be prescribed rather than, So Thailand, aside from the fact that, you had the buying over the counter, are you saying that really, or the point you're making is that there it felt more streamlined, efficient, you knew what to do, where to go, there was no nonsense? I mean, I know in Germany we were paying something like 7% of our salaries or something towards private healthcare when we were there.
Yeah, I think whichever way you look at it, you have to pay for something to get it, and it just might look efficient in Thailand, but you're paying for that efficiency. And that's a choice that,
Was it private? Like, did you pay out your salary for it, or was it a tax or a...
Yeah, it wasn't government run. It was private stuff. So you paid. It was part of work. As most companies are in Thailand, you joined, and instead of being on the pension, most people were interested in what the hospital thing was.
Right.
So
right.
you get hospital care,
and then it gets like a salary sacrifice type thing.
Yeah, I mean, I had my hernia operation in Thailand. I had I had a cortisone injections, and honestly, you just turn up the next day and they would give you them. It's like it was so, but you're paying for it. But it's like, where are we going? Like, if you were in trouble, you would ring 999. Yeah. Now if you're in trouble, do you ring 111 first, or do you ring 999? Which one do you ring? And so now we've got these add-ons.
The hell out of me. It
Yeah?
confuses the hell out of me. I have no idea.
Yeah, and it was something I was talking to my dad about, and also my sisters. But and I agree with this. If we were talking about from a lean efficiency point of view, we would be moving certain hospitals into certain categories of looking after that. Whether it was podiatry or whether it was gynecology, certain hospitals would. But the problem is, if you've got three type of ailments that you're being have looked at. You are expected in the northeast now to go to three different hospitals, and that's tough. You know, if you don't drive or whatever, you know, oh, for this appointment, can you turn up the RBI? For this one, can you go to Rakeley? And then for this one, can you go to Cramlington? And it's like,
Yeah.
now in the old days, you'd have just turned up in A&E, and then you would have been at Rake Lane, or as my brother Ray likes to call it, Mistake Lane. Um, so at Mistake Lane, you just turn up, and that's where your treatment would be, wouldn't it? But there seemed to be centralising, which I don't necessarily disagree with, but it's tough for the patients, isn't it?
Oh, so they're centralising specialty care rather than having a specialist in the hospital. There is a specialist hospital rather than
Yes.
having a consultant in each that does that
No,
thing.
and that from a cost perspective, we were talking about, you know, making efficiencies in the NHS. You wouldn't have a gynaecologist in Rake Lane, Cramlington, and in the RVI, would you? You'd have one in one hospital, and you would move it to him.
I suppose in a way what you're doing is separating the traffic.
Yeah,
So
officers,
rather than
buildings,
having,
infrastructure.
rather than having all emergencies going everywhere, there are going to be some conditions that are lower traffic than others. So then, if you're pointing them at that hospital, then that one's then going to all of a sudden have more capacity because it's only dealing with those things. So you can maybe top it up with one other specialty, and it gets nicely funneled, which takes pressure off this other one. Because they're not having to deal with hands and feet or ear, nose and throat anymore, because they're only dealing with these types of operations and that kind of stuff. So, I mean, I suppose you could say it's an effort to make things more efficient.
Yeah, and I don't disagree with that. I think with anything, there's pros and cons. The difficulty being is like, you know, my dad's he's got issues with his eyes, so he has to go to the RVI. But if you've got issues with other parts, you've got to go to different hospitals. And we were having this fun conversation about how does he get to the RVI, because like for him and his perspective from West Allotment, you might as well get a flight to Newcastle because it's that far away. And I'm just looking at it thinking it's 15 minutes away, you know. And but you know, it's the old thing about going through the Tyne Tunnel, you need to get a packed lunch, get yourself ready if you go through the Tyne Tunnel. And but it just started because Anita's changed a job a few months ago. Now, part of this job that she started, there's an offer of Bupa. Yeah. So, and I think as we move across in the next few years, more and more people are going to be looking at employers' benefits, and I think private healthcare is going to become more of an agenda, more of an attractive thing.
Did you see what the Reform Party are offering?
No.
They said that if you were willing and could afford to go private, they would give you tax relief on your salary to promote that. So if you can afford it and take pressure out of the public system and afford to pay for your own, they would pay you in kind, or at least give you some relief on your salary in order to better afford that. So they're trying to promote people that can to do it, to move over. And these days you can include it in your life insurance and your mortgage and that. So, you know, when you have the likes of Vitality and what, you can include all of your health insurance, life insurance and all of that stuff together as part of your mortgage stuff, because you're expected to have life insurance whenever you take out a mortgage to cover it, right? So I know a few people that can and do, and sometimes don't use it because they think, oh well, I'll go there, and then they realise, oh look at the queue. I mean, didn't you went private for your ADHD, didn't you? And that was a pretty good experience.
Well, to be fair, I paid for it myself through the business, but yeah.
You essentially went private, didn't you? Rather than hang on. It could have been months otherwise.
I got an appointment like that, you know.
Yeah, because all the mental health stuff and neurological diagnostics and whatnot. I mean, I was told 15 months when I first went for mine. It ended up being 2 years for my autism assessment. And I only got it then because it was the pandemic and they'd started doing video calls instead. So
it was interesting because if you go back, Simon, across the pandemic and the fact that we weren't really allowed to turn up at A&E, people stopped going, didn't they? So something happened. There was a shift, and that either people weren't really that bad, or the worst thing in the state of the NHS now are people avoiding going because they know how long the treatment takes.
This is it. This is it. This is something I worry about. That if out's happened, and my dad's been for an ECG lately, and a CT. He's had an MRI, but there's weeks in between results. I'm like, well, they're literally on the screen. You know, when you get an X-ray, the radiographer is trained to read the X-ray and has to tell the doctor
yeah.
the results,
Yeah.
right? So, I mean, they could literally do them then. So, right, if you come back in 3 weeks, the results will be with your GP. I'm like, what? But then you have to get the appointment with your GP, which could be, you know, luckily, and I agree with this, that them being in their 70s, they get preferential treatment for appointments, like, you know, priority treatment for appointment. That's absolutely fine. But he's had his heart scans and whatnot, and it's always another month. It's always oh well, we'll get you. You'll have your results in 5 weeks. I'm like, well, right, right. But somebody's obviously looked at that and went, yes, this and this, left some notes, and I said, well, why is it 5 weeks? Why is it not just bums on seats that are trained to read these things, rocking up the notes, and then pushing them across to your GP? Why is it? I mean, what is taking 5 weeks?
Yeah.
So this is so. Hopefully, you kind of get to the point where you hope there's nothing serious. I mean, look at cancer patients. You know, it's months to get the appointments and to get the scans and the confirmations, and then it could be months before you're put on a plan of treatment, and months in some cancers can be the difference between stage 1 and stage 4, right? So, and at that point, that's it. That you could have caught it early. They did, but they didn't.
It was like because this Anita asked me. She says, "Do you want to go on the policy at work?" It costs. I think it costs us £60 a month for me to go on her policy. So I've gone on it.
Could be worse, like £60.
Exactly, you know, and I've got this appointment on the 20th. Depending on what is said at that one, Anita said, asked to be referred for private treatment. Depending on what's here. Now, we're talking there about companies offering private healthcare, but at which point should we be deciding if we have the ability and the money to take out our own private healthcare plans? Because you know, people like your mum and dad, as we, if I suddenly got told I had cancer tomorrow, do I want the ability to have my treatment started straight away? Yes, I do.
Well, yeah, you do. Yeah.
Yeah. And under the NHS, it wouldn't happen.
Yeah. They've been private a couple of times because my dad used to work at Eager, and they've got these discounts on different things. So he sent me mum for a couple of diagnostic things, and it was like that. Mind you, she's had her cataracts done right at the beginning of the year. That both of them were sorted in the space of 4 to 5 weeks, and that's only because you have to have a month apart. But she went into the opticians. He said, "Yeah, I think it's about time you had them done." She had a phone call from the surgery the following week, and she'd had it done the week after, our first one, and she had the whole thing sorted inside of 4 to 5 weeks. Both of them done. It's because all of those patients had been pushed into private overflow, so the NHS paid for it, but it was a private clinic. And then somebody on the news complained that private clinic's getting all this work. I'm like, you look how well it works, though. She was in and out same day, with some eye drops, and that was it.
I think it's an important thing. It just made me think about something there, which is, and it's not talked about much. In theory, you could go to any part of the country and get your treatment on where the list is the shortest, couldn't you?
Yeah, well, they say it's a postcode lottery and that depending on where you are, and I mean, yeah.
But you are allowed to travel.
You could. Yeah.
You are. I mean, I've seen it advertised that certain certain parts of the country probably have a shorter waiting list for tonsillitis than other parts of the country, and you could travel. You know, it might be cheaper to go in a Premier Inn or a Travel Lodge for a couple of nights and get your treatment flipping down south. I don't know, or in the Outer
Yeah.
Hebrides.
Yeah,
Uh, but
yeah, could be.
it was, you know,
be.
but we know it comes down to simple mathematics, doesn't it? It's 75 years ago, in what, 1950-ish, we had a certain amount of people in this country, and in 2024 we have a certain amount of people in this country, and we put a certain amount of money in, and the maths doesn't work out, does it?
No, even the way that it's built, it wasn't designed to do this. It wasn't designed to do this. That wasn't its original intention. It wasn't designed to have GPs, surgeons, specialists, and have gynecologists and foot specialists and ear, nose, and throat, to have ambulances. All of that. It wasn't designed for everything that it does now. That wasn't its original intention. And yet nobody has stopped for a minute and went, right, things are changing, can we do a redesign? No, and now anytime anyone says, look, we need to revamp this whole thing, you're going to privatize it. Ooh, it's this horrible sort of political
Word,
potato that
We're just
like
bringing
no party wants to touch it because everybody goes, oh, you're going to privatize it, you're going to get rid of it. Oh, you can't touch it. Our precious NHS. Or is it? It's a mess at the minute. Surely we could actually get it back to being precious by just letting someone fix it.
It's really, really tough subject. But how many people on a Monday morning at 5 to 9 ring that phone for an appointment at their doctor's just to go in and have a conversation with the doctor because they're lonely?
Oh, it's 8 o'clock here, like.
Yeah.
You're
Well, I'm not feeling so well.
8 o'clock.
I'm not feeling. It's that old thing like when you're at a job. Well, I'm not coming in today because I'm not feeling so well. Oh, what's wrong with you? I'm just not feeling so well. Oh, okay. And you ring up the doctors at 5 to 9. You say, I need to come in. What's wrong with you? I'm not feeling well. No, I need you to be a bit more specific. No, I'm just not well. I want an appointment, and I'm on the phone, and I want an appointment now.
Well, the receptionists triage it now, which
Yeah.
is one reason why I don't ring, because they're like, so what are the symptoms? I'm like, well, I don't want to speak to you about it. It's not up to you.
I see.
And the one time I did, she referred me to the nurse instead of the doctor, and the nurse went, you should speak to the doctor about that.
Yeah.
So, well, that just proves to me that the receptionist isn't the right person to triage calls.
What I say on Facebook today. It takes 7 years to qualify as a doctor, but for a receptionist, it takes 3 minutes to qualify as a doctor.
It does. And as a GP, it takes 12 years.
Yeah, so the receptionist automatically become a GP. No, you're not getting an appointment. I don't think
it's
you're back.
They've probably, like NHS 111, they've probably got a script. If it's something like this, refer them here. If it's something like that, refer them there. And then they pressure you to, you know, maybe the nurse could take care of that, and you could see the nurse sooner, you know. And the thing that bugs me is, I remember a day when you could ring the doctor for an appointment on Thursday.
Yeah.
So you could ring Monday and say, look, I need an appointment sometime this week. Now, you have to ring at 8 to get the appointment. If there's none left, you have to ring again tomorrow. You can't book them in advance. Only
what year are we
pensioners
in?
can book them in advance.
Simon, what year are we in? You know the systems that are out there. You ring the number, it takes you an automated system, and it gives you an available appointment, next one, and you press yes or no. And, you know, it doesn't need to be 9 o'clock on a Monday morning.
No, I mean, they do have an online booking system where you've got to go in to get your code to then type it into the online booking system so you can then make your online appointments. And
I suppose the other thing was, you know, it sounds like a bit of a beating to the NHS, and what I would say is that the people you meet in the NHS and who help you are fantastic people.
that's the difference, right? That as an organisation, it's balls.
Yeah.
The way that it is, the wastage and the use of public money. Forgetting that it's public money, like it's all our money, right? But,
Yeah. Now, the fact that
the doctors I've met have been absolutely the people who assessed me were unbelievable.
And you forget,
Unbelievable.
you forget these consultants that you see in the NHS, right? If you went private, you'd see the same consultant.
Yeah, you would.
You
9
would.
times out of 10.
Anita did it. Anita's getting something done recently, and they said, "Oh, there's the list of the private consultants you can have." And she went, "I've seen them too on the NHS." She went, "Well, you can have them because they're on the list." And she said, "Yeah, he on a Thursday he consults for us, so he doesn't work for the NHS."
Yeah, because there's only so many hours that they can do in a week. As well, there's like GPs, for example. They only do 3-day weeks. Because they burn out, right? Because they do long hours, 3 days a week. And you think, well, if you're doing 3 on, 3 off with 12-hour days, then you're like, well, so does everybody else, right? That's fine.
Yeah.
Oh, and I've got to open weekends. I've got to open this. Well, right. Well, it's the same with doctors. In hospitals, they might do 3 16-hour shifts, and then they can't work in the hospital. They've got to go do something else, but they still want to earn money, right? So they go private.
Yeah.
I sort of can't. I can't blame them as such if that's the way the system works and that allows them to do it. They're not doing anything wrong, right? So
I mean, my question would be, as a consultant, why am I not doing private all the time? That takes some level of dedication to stay with the NHS, doesn't it?
well, this is why a lot of them are doing off to Australia because their wages are better. But what they're not telling them is how expensive it is to live there.
Oh, yeah.
It is expensive compared to here. It's far more expensive. So the wages are only relative, right? So, but what the government were proposing to do was, tell you what, if you work for 5 years minimum for the NHS, we'll write off your student debt at the end of it.
Why not?
Because the student debt for doctors is enormous. You can imagine having to do 8 to 12 years depending on your specialty, right? I mean, surely that's an incentive. Stay with us for 5 years, we'll write off half your debt. 10 years or 7 years, we'll write off the whole thing.
For me, that's just a maths question.
Yeah, and then after that, you're free. You're a free agent. You don't owe any money. You don't owe any loyalty to anyone. You can go and do what you want. But at least we have had you for that amount of time. We invested in you. We made you invest that training back in us for 5 to 10 years, and now you're a free agent. I think that's fair. It's a fair question.
Yeah.
Why not?
It is. I mean, obviously, we take a large proportion of nurses, etc., from other countries.
Isn't that the irony, though, that ours are doing off, so we're having to import them from somewhere else? So they've all gone off to Australia and all these other English-speaking countries. We take them from non-English-speaking countries to replace them, and perhaps don't pay them the same. So there's something wrong with the way these revolving doors are working. Our own people are going out, and these other people are coming in. And say, well, hold on a minute. If we're doing this sort of one for one, then why don't we do something that keeps them here?
Yeah.
Rather than, because at the end of the day, we're taking them from other countries. Now that other country has the same problem, that their nurses and doctors are leaving to come here, so then they don't have them. So then it just seems like this is this massive rotation of doctors across the planet, and nurses just shifting right one and going, ooh, yeah, that's paid more, that's paid more, that's paid more. It seems like a bonkers system.
Well,
Somebody
it is.
needs to sit and figure it out.
We know we know that any decent employer in the private sector will be judged on their turnover numbers in terms of people.
Yeah.
And that tells you about the culture of the organisation.
Yes. Yeah.
And that would be a fundamental thing that you're looking to get right, is to reduce the turnover effect. Because, there's something about the cost to interview, employ, offer, blah, blah, blah. The amount it costs is ridiculous.
Oh, and 3 months to get them up to scratch.
Yeah.
And depending on the role, that could be 6 months to a year. Yeah, the industry. I mean, yeah. I mean, if it's an office job, 1 to 3 months maybe to get up to speed. But then your productivity is lower for that amount of time. Yeah. You're technically investing in them, and if they end up miffed at the end of those 3 months and leave, then you start from scratch again. People don't seem to see a cost to that whole thing.
We've never mentioned the fact that over time, it seems like the care industry has moved because obviously my daughter and future son-in-law they work in the care industry, and that has moved more away from the NHS and more into the private sector as well. Um, so yeah, there's another angle where money, resources, etc., has been moved to a different place.
Yeah, I went for an interview for one of them,
Hmm.
who said that they're now they've completely redressed all of their pay structure, not just internal, but in the offices, but out on the coalface, as he put it. He says, "Oh, we're now one of the highest paying in the social care sector because they saw just a lot of attrition, a lot of people leaving, going abroad, going to different countries, or burning out,
Yeah. How do
burning
you
out." So
how do you sort of see the request at 35% pay rise by, is it the junior doctors?
they've been offered. They were offered 9. They've now been offered 12.
But they want
That's
35, don't they?
They want 35 because they've added up the last 5 years or so and said, if you look over those 5 years and compare that with inflation and what everybody else is doing, we're actually 35% behind where we would have been had we had proper pay rises each year. I said, well, yeah, but 3 years ago you weren't complaining that you were 2 years short.
Yeah.
You've waited 5 years to complain, and now you're asking for a completely unreasonable... I mean, you're asking for more than a third increase to your salary across the board, and it's a percentage. I don't agree with percentages. I think it should be an amount.
Yeah.
And the government has offered them 12% with it being backdated to the start of the financial year, so all the way back to the 6th of April of 2023. So they'll get this enormous lump sum of 30% of their salary. And so far, they're planning on going on strike.
Yeah.
And they're not junior doctors either. They're called junior doctors because they're not GPs. This is what...
Is
or
it?
consultants yet. Yeah, so they're just the... they're not junior as in junior. It's just that's what they call hospital doctors before they go into a specialty and become a consultant or an attending.
So junior's the wrong word for them, isn't it?
It is.
Yeah.
It is. And this has been mentioned on the news, but it's a bit of a derogatory term.
Yeah, because from a public perception, my perception, you've educated me on that. Mine is that it's somebody that's in their early days, or they're young people.
Not necessarily.
Yeah.
It includes them. It includes them, but it basically means the bottom rung of the doctor ladder.
Yeah.
So it could include those that are just starting out, but it also includes those that haven't specialised yet. So, and that is, if I remember right, a 3 to 5 year gap. Right, so it could be people who have been doctors for 3 to 5 years are then saying, so they've been their whole 5 year career so far, they've been underpaid by this 35%. They're reaching the end of it and want this hike. So yeah, but they go in on mid-30s, and by the time they finish, they're towards 60s. All right, so they're up there, and as they go into consultants, it obviously skyrockets. So really, what you've got is 3 to 5 years of pain, and once you hit a specialty, admittedly, you have to find a hospital that has an open slot in a specialty to then go and do it. So you are kind of hanging around waiting, and you might have to move, so then you have to make a compromise to go and get the slot you want. But it's an enormous leap into 6 figures. Yes, maybe they don't all get it. Oh yeah, but I've got all these student loans to pay back as well. That eats right into that amount. I'm like, yeah, but if you're on 150 grand up here, that's a shed load of money. It's not a lot in London, I can tell you that. 150 grand down there is not an enormous salary. Not when you've got a family and whatnot. You would have to live well outside of London to make any use of that kind of money. But there's a lot about that whole argument that is assumed, and for some reason only certain channels kind of fill you in. And the only reason I know it is because the channel I learned about it on, there's presenter and his co-host are both doctors. And he explained it and went, junior doctor is actually a bit of a derogatory term. What it means is those that haven't specialised yet. So it could be those straight out of uni. It could be people in their mid-20s or 30s, that have been hospital doctors. That's what we should call them. Before they've gone into being GPs or surgeons or specialists in this or a consultant in that, that kind of thing. So we make it sound different to what it actually is. When it's junior doctors, it's all these people that are just come out of uni. They're all 20, 22, 23, 24-year-olds. They're all these young kids. That's who you see on the picket lines there.
Yeah.
The public face of it, but it isn't. It's a bunch of age ranges. Aside from the fact that one of the doctors that's on this show, she started quite late in life. She was in her 40s before she decided to go and be a doctor. She trained very late. But just decided to upend her life and go do that. So you have these mature students doing it as well. So admittedly, they don't start on a great salary. It quickly ramps up. And then when they get to the point where they've gone through their initial years as a hospital doctor, they can then go out and privateer. They can go out and do private consulting. So there is money to make on the side. And what they don't mention is all of the hours that are available for overtime.
Yeah.
And unsociable hours and weekends and all of that. So,
well, when you've got turnover rates like they've got, I mean, the father-in-law he was due an eye operation. He had it cancelled because the guy's left. So and left is a terminology. So he's clearly gone as a consultant, more than So,
and there is burnout. Burnout. That is a thing. And there are those that get so far and realise that you've got to be a certain person to cope with some of the tragedy you're going to meet. You're not going to save everyone and all of that, So you've got to be mentally ready for that sort of job as well. So, and it's not for everyone.
No.
But it doesn't feel like it's seen as a vocation anymore.
No.
Like for a certain kind of person, like, this is because I'm doing this because I care about people and this allows me to do that. It's all been very financial. And I blame the unions for that sort of stuff.
Yeah. Yeah. Well, it was an interesting subject, and my mother's got her boot up because she's had a toe operation this week. So she told me that she'll be listening to Loose Gadgets and catching up on bits because she's got the next 4 to 6 weeks where she's immobilised.
It'll be one of them moon boot type things.
It is, yeah, exactly.
Yeah, one of them massive things.
Yeah, she sent me a picture and I had a chat with her on I think it was Friday morning, and she was in good care. She went private, but she's got 6 weeks where she's got some books and some programs to watch and podcasts to listen to.
We'll have to keep her entertained, then,
Yeah.
Aye.
Yeah.
Right,
Yep.
So just the one episode this week, but we felt it was chunky.
Chunky.
It was chunky, and we have gone in all sorts of directions, and I think if we'd cut it any shorter, we would have missed out something important, because this is a sensitive topic, so you have to make sure you qualify and clarify and add disclaimers and whatnot. Make sure stuff and things.
Yeah.
But next time, I'm going to do some. I've been promising to do this for ages. I'm going to do some autism-related stuff next time. So, Mark, for next week, what would be interesting is if you came up with some questions about it that you don't know, that maybe you want to know, or things you've noticed or seen.
Yeah.
And I'll answer them. And what I'm going to do is find the most asked questions by parents of autistic children. And I'm going to try and answer them from my perspective. And try and shed some light on it and see how it goes. I'm going to do it. I've been saying I was going to do it, so I'm going to do it. But until next week, give us some likes and subscribes. It helps us more than you know, just hitting the like button. Hitting the follow button helps us more than you know. Gets us into the algorithms and gets us known. But until then, take care.